Hi, I'm Dr. Sridhar. In this quick video, we will discuss whether it's important for a pediatrician to be familiar with other alternative forms of feeding in addition to breastfeeding. There is no doubt that breastfeeding is the best for the baby, and we should try everything we can do to support breastfeeding right from the time of conception. And in some cases, maybe the incidence varies depending on the situation you work and live in. So it may be as high as 20 to 30% that the babies need formula feeding in some parts of the world, and in some parts like India or the developing world, the breastfeeding rates are higher. Maybe 10 to 15% of the babies may need formula. And there are parts of the developed world where breastfeeding rates are really low despite the best of efforts. So there is a significant proportion, so whether it is 10%, 20%, 30% or more, there is a significant proportion of the patients who might need formula support. So it's very important that we provide a good care for these babies as well, and part of that care is educating the parents on suitability of formula, how to sterilize the bottle and safe formula feeding. It's very important that pediatricians are familiar with this because they are the ones who will give the parents these advice. If you look at the Baby Friendly Hospital Initiative, the WHO guidelines, or the Infant Milk Substitute Act, there is always the provision that if the parent or the baby does need infant formula for any reason, appropriate education is important, and this appropriate education can only be given if the caregiver knows how to do it. And this is part of the 20-hour BFHA training as well. And my request is not to ostracize the parents who may need formula or they may need to mix feed for any reason. And obviously we want to avoid the bottle feed in the developing world due to the risk of infection, but if the parents have a requirement and they are capable of giving it safely, we should educate them. If there is a risk of infection, the parent should be explained that, and cup or cutlery feeding should be taught to the family. The pediatrician should be aware of the different problems that can be associated with formula feeding as well, regarding the quantity of feeding, what devices are used, how they can sterilize, what the size of the teat should be, and so on. So please spread this news that teaching the techniques of formula feeding is not against breastfeeding, as you are targeting the group who may not be able to exclusively breastfeed. Safe treatment of such babies is important as well, and we should be an advocate for all babies, not just for the breastfeeding babies. But the most important message is nothing will beat breast milk, and we should do the best we can as healthcare providers to support breastfeeding mothers, establish safe and exclusive breastfeeding for the first 6 months. This is the main objective. And if there is a problem, we support them to at least breastfeed as much as possible, even if they have to introduce other milk substitutes. We should be aware of what substitutes are